So we just concluded a half century of Arab Health here in Dubai. And this is also going to be the last Arab Health. We had over 300 guests at our breakfast briefing with the Dubai Science Park. What's on tap for 2026?
Well, breaking news. This is the end of Arab Health. Or this is the end of Arab Health as we know it.
Sure. Hello, today we are doing a wrap-up of Arab Health 2025 right here in Dubai. I'm Christina Sochacki, and I head our healthcare and life sciences practice for Saudi Arabia. And I'm joined today by my colleague.
My name is Andrea Tithecott, partner and head of healthcare and life sciences.
There's quite a few hot topics that have come out of Arab Health, but I think maybe top of mind for me when we talk about AI and the use of data in the region, quite a few companies are asking about, well, what in the UAE actually regulates the use of data? And fun fact is that we have a law. And during one of the discussions with Dr. Ramadan of the Dubai Health Authority and Marwan of the DSP did highlight this, that we have an ICT and health law, including executive regulations, which are quite instructive on the use of data in the UAE. So can you tell us a bit more about that?
Yes, well, the UAE has been very proactive in terms of seeking to regulate the use of data and how we might all access and share the data in the healthcare and life sciences context. Now, the law is a very high-level principle-setting law. Of course, protecting patient privacy and confidentiality, but also setting out some parameters for that, who owns the data. Once it's created, how do you store it? How long should you store it for? Who can access it? And where can you access it from? There are restrictions in the law about data residing in the UAE and restrictions around who can access the data from outside the UAE. And now with the current focus on research coming out of the data that we hold, how do we do that research? Who's going to have access to the data? How is it analyzed in terms of AI being used in data analytics? This has been a real question for UAE government at federal level and at emirate level in terms of how we manage that whole piece to keep control of it so that we can generate really good research data and affect patient outcomes in a positive way, but also in a controlled and in a safe way. Now, we are still evolving the regulatory framework in this regard, and we heard during the course of the week that the regulators, the stakeholders, the international community and the research organizations are looking at how we can manage that whole data security and sharing piece in a way that suits all. The regulations, of course, are behind the political intent, the political ambition, and how we will all do this from a technology perspective. But we are moving in the right direction. We currently don't have any data adequacy agreements in place between the UAE and any other sovereign state. But all of the business groups here and the sovereign collaboration partnerships are working really hard to do that. Meanwhile, of course, we need to think about data security, interoperability standards, and how do we identify international research organizations, medical academic universities, and how do we create an environment where everyone has trust and confidence? Now, the Department of Health in Abu Dhabi announced earlier this week through Dr. Hashmi at the DOH in Abu Dhabi that for clinical trials purposes, they are setting up a data lake, which will come online in approximately Q3 of this year, where there will be that volume of data that will be accessible by collaboration partners internationally. And that's a really good starting point in terms of creating that environment for data sharing and having that trust internationally. And that's what we need going forward if we're going to also meet other very ambitious targets that we will speak about in a moment.
Well, that leads me to something that Dr. Sahar Al-Mazouki from the Department of Health Abu Dhabi spoke about in terms of the genomics law. So we know there's the Emirati Genome Program. And in fact, there is a law that regulates the use of the human genome in the UAE. And quite often during this week has been the talk about longevity. and defining that. What is longevity? It's not just lifespan, but health span. But how? And something quite interesting happening at the DOH is they're using the human genome to create precision medicine, preventative medicine, analyzing it in terms of pharmacogenetics and giving patients and doctors those reports. I know there's a collaboration with M42, which is involved with gathering that data from ALAFI, the Health Information Exchange there. And I think that leads to maybe a few comments that you might have about the use of that. It's data. There are some exceptions to how that data is used, some of the approvals, and some of the programs that can stem from the genomics law.
Well, the core of this is Abu Dhabi. Abu Dhabi started the whole discussion around genomes 10 plus years ago, culminating in being the first country in the Gulf to create a human genome program, and have now, through that program, sequenced between 750 to 800,000 Emirati nationals whole genome screening. The figures differ depending on which event you went to this week and who was speaking, but we're talking substantially around 75 to 80% of the Emirati population have been screened. And we understand that perhaps during or by the end of this year, they will have screened the entire population of UAE nationals within the space of around 5 or 6 years. That's absolutely remarkable. Yeah. And we now have all of the data from that. Also in relation to the human genome, we have seen fragmented across various laws and regulations, some element of control over the use of the human genome. But in the last couple of years, that all coming together under the umbrella of one law which governs the use of the human genome from the political perspective, from the ethical perspective, what we are going to do with it, what we're not going to do with it, prohibiting human cloning, and some other aspects of ethical research into genomics. But this is really pushing forward now a huge range of research in the not only genomics and genetics, but we're now into omics, multi-omics, proteomics, you name it, we've got eyes on it and we want to do research on it. And the regulation is broad enough to include all of those other categories and really create a positive framework for how this topic is regulated. And when you listen to Dr. Fatima Al-Kabi, the Director General of the Emirates Drug Establishment, who has just in the last 4 weeks published the pharmacy law, law number 38 of 2024, and is going to publish a whole raft of regulations, standards, guidelines that will regulate this entire industry, whether it's human research or veterinary research. She has purview over everything. So it's an extraordinary range of powers that she's got. She said, Andrea, we are going to create these regulations. She said, I don't want long, complicated regulations that are going to stifle what I'm trying to achieve. I want commercially focused regulations, and I want them now, I want them quickly, so that we can all make a start to work within this new environment. And so we do have a great opportunity now to really spearhead the life sciences industry as a whole, including genomics, because we will be using all of the data that we have gathered and, you know, new research and new data that will be created. All of this data, yes, going into health information exchanges like Malafi. Ministry of Health also set up their own information exchange, similarly in Dubai. We don't have a completely joined up system at the moment, but it's not impossible to conceive that. And we also have the establishment of biobanks. We have a new biobank regulation. We have M42 in Abu Dhabi that won that project to establish the biobank for Abu Dhabi, working with the Department of Health. So we have a lot of other screening data going into the biobank as well, and an opportunity for the private sector to establish their biobanks and also contribute data to the biobank. So data coming in, samples coming in from a variety of sources, Yes, pretty much government-led, but an opportunity for the private sector to come in and occupy this space as well and make a highly valuable contribution.